going to talk about scar tissue mobilization. So I'm going to give the example of a few scars that I have around my forearm, one that's down here and one that is right here. Scar tissue, you can make some changes even if it's been a little bit of time. We used to think that if it was past about a year that we couldn't really make changes. There's been some cool studies and also a lot of people practicing scar tissue mobilization that have shown that that's not true, that we can improve pain or discomfort from scar tissue that isn't moving well as what it should be. So to check a scar to see if it needs some help, what you're going to do is you're going to find where that scar is. So I'm going to take this one as an example. And what you need to do is with like gentle pressure, you're going to move it in all directions. So you can do that by like putting your finger flat on a place and moving it around like this. You can also like pinch, and you should be able to pull your skin away from the tissue underneath it, sort of like anywhere along in your body. And there's some areas that's easier or harder depending on like what's going on in that area. But as a good check, you want the skin to move as well over like one body part on both sides. So if you have a side that like doesn't have a scar, you want to do the same thing where you're like pressing down and wiggling it kind of like a clock in all directions, as well as then you're like picking it up and seeing like, can I pick up and wiggle like just as well on like my one side as like on my other side? If the answer is that the scar is restricted in some area, the skin doesn't pick up as much, whatever it is, you're just gonna work on it. So working on it means like over time, doing some like little scar tissue wiggles. I don't have a good example on my own arm of like scar tissue that isn't moving well, just because these scars at this point are a little bit over a year old. I'm a physical therapist who does this kind of stuff, so I've been working on my own scars, but this one on my elbow initially was kind of like sticky. The elbow's kind of like a weird place, right? So what I did to work on this elbow scar was that I did exactly what I showed you. I wiggled up and down, side to side, in diagonals, in all directions. I'm applying maybe like 4 or 5 out of 10 pressure. It's not very much. I'm not trying to like rip up the adhesions myself necessarily. That's not the energy. The energy is more like wiggle it around, get it moving. You're giving your body some like good input to like help things out. So you can do the wiggles in all directions. The other thing to do that's a little bit more aggressive but is good to do is to pinch and wiggle also in all directions. So I'm pinching my skin and I'm giving it a good wiggle, and just trying to, again, get things moving, drive some blood flow to the area. For the elbow, you might have to kind of like, you could bend and straighten your arm while you hold it. That's kind of what you're going for there. Sometimes touching a scar, having somebody else touch a scar, or you touching your own scar on your body can be pretty uncomfortable, either physically or kind of like emotionally. Scars usually represent things that were kind of stressful for us, right? Like for these two, I fell off a mountain bike and that kind of sucked. But if you have some discomfort come up, do your best to kind of like work through it so you don't have to. Rome doesn't get like built in a day, right? So you're not going to change everything in like a single session. The magic in this is doing it over time consistently. But what folks tend to find is that as they do this over time consistently, the tissue starts to move a little bit better. The spot gets a lot less sensitive, and they're able to kind of like do more. I had a client who had a scar right here from a procedure that initially was like really sticky, didn't really want to move well. She didn't want to touch it. She didn't want to look at it. But over time, as like I worked on it, and there's some extra things that a PT can do in session that are helpful, like dry needling, as well as like as she worked on it over time, it got better and better. But it's really important to get scars moving, just because you could imagine like our skin is kind of like we're wearing this like onesie kind of all over us. And if we've got a spot that's really restricted here, for example, it's kind of like somebody took a clothespin and like grabbed that spot. So like as you're trying to move your neck or even your shoulder, all of the like muscles and fascia in the area can be related and affected. So anytime you've got a sticky scar, or anytime like you have a fall or surgery or whatever it is and you've got a scar, once the wound has like closed and it's like skin and just scar over the top, you should be like wiggling and checking those scars and making sure that things are moving in the right direction.